The first thing that we're going to do is introduce ourselves to the patient, and we're also going to verify the patient using 2 patient identifiers. We always want to perform hand hygiene and have infection control at appropriate intervals during the procedure, and we want to use protective PPE at appropriate times and maintain aseptic and sterile technique when needed. So we're going to explain the procedure to the patient, and we're going to answer any questions the patient may have prior to and any point during the procedure. The next thing that we're going to do is prepare the suction. That means we're going to turn on the suction device. We're going to set the negative pressure to suction less than 150 mmHg. Then we're going to verify the suction is working by occluding the end of the suction tubing before attaching it to the suction catheter. If indicated, we're going to increase the supplemental oxygen to 100% or hyperoxygenate as prescribed and encourage the patient to take a few breaths. So the next part is to prepare the disposable suction catheter. Using aseptic technique, we're going to open the sterile catheter package on a clean surface and use the inside of the wrapping as a sterile field, exposing the connecting end and connect the catheter to the suction tubing. And then we're also going to open the package for our tracheotomy, ostomy, clean and care tray, and we're going to fill the basin with sterile 0.9 sodium chloride solution. So now we are going to open the packages. And fill the basin with that solution. Next, we're going to perform hand hygiene and don our sterile gloves. Now, with our dominant hand, we're going to pick up the suction catheter, wrap the catheter around our sterile dominant hand to help prevent an advert contamination of the catheter. With our non-dominant hand, we're going to pick up the connecting tubing and connect it to our suction catheter if we were to have that today. We're going to ensure our equipment is working by suctioning a small amount of sterile solution from that basin with the catheter. With our non-dominant hand, we have this tip that would be plugged into the suction catheter and the sterile end that will be going into the patient. So with our dominant hand, we're going to gently insert, but quickly insert the catheter into the tracheostomy tube until resistance is met, and then pull back 1 to 2 centimeters. With the non-dominant hand, we're going to depress the control vent of the suction catheter to apply intermittent suction while completely withdrawing the catheter up to a maximum of 15 seconds. This process may be repeated as necessary, allowing a minimum of 20 to 30 seconds in between attempts. After we're done suctioning, we're going to return the supplemental oxygen to the provided flow rate, and we're going to dispose of used items with an aseptic technique. Into the trash and dispose of this. Next, we're going to wash our hands, and now we're going to do the tracheostomy care with a non-disposable inner cannula. We've already prepared our needed supply kit, and we're going to don regular gloves here, non-sterile gloves. Now, while touching only the outer aspect of the tube, we're going to unlock and remove our inner cannula of the tracheostomy tube, and we're going to drop the inner cannula in that 0.9 sodium chloride solution to loosen the secretions. So we're going to remove that now and drop, and then we're going to position the oxygen source over the outer cannula. We're going to remove our gloves, perform hand hygiene again, and now we're going to don sterile gloves. Now we're going to clean the inner cannula. We're going to hold the cannula over the basin, and we are going to use the brush to clean inside and outside of the cannula. And dispose. And then we're going to take our sodium chloride and rinse the cannula. Now we're going to reinsert the inner cannula and secure with the locking mechanism. If ordered, we're going to reapply the oxygen if needed and hyperoxygenate the patient. Next, we're going to provide tracheostomy site care. The first thing that we're going to do is remove the drainage sponge and discard. And then we're going to come over here and clean the exposed outer cannula surface and the stoma under the flange with moistened cotton-tipped applicators using that same 0.9 sodium chloride solution. We're going to clean the area extending in all directions from the stoma and clean in a circular motion from the stoma outward. Our cotton-tipped applicators in the solution around the stoma in a circular motion. Discard. And one more. And cleaning under the flange. Next thing that we're going to do is pat dry the skin and exposed outer cannula surfaces by patting lightly with a dry gauze. Okay. And then we're also going to insert a fresh tracheotomy dressing under the clean ties and flange. Then we would maintain and secure the tracheostomy using the tracheostomy tube holder method. This means we would maintain and secure onto the whole tracheostomy tube, align the strap under the patient's neck, and make sure the Velcro attachments are on either side of the tracheostomy tube. We would place the narrow end of the ties under and through the eyelets of the faceplate, pull the ends, and secure the Velcro closures. We're going to verify that there's enough slack to slip and the width of 2 fingers under the neck strap, which we do. And then we're going to ensure the patient's comfort and safety, which includes assessing the respiratory status of the patient. And to wrap up, we would then place the cap over the sodium chloride, place the date on the bottle, and store it in an acceptable area. We would ensure that items are used and stored and disposed of properly. We're going to position the patient and place their items within reach. And we're going to remove and dispose of our gloves, clean our hands, clean up our area, and finally we would document and report the patient's status and how they handled the situation. And that's it.